Everyone 6 years and older is now eligible for the brand new COVID-19 booster, even if you've never been vaccinated before. With fall right around the corner, COVID-19, flu, and RSV infections are expected to rise. Tonight at 6:30, Bronte Sorotsky joins us in studio with what experts recommend to protect ourselves against all three of these viruses.
Well, fall might be around the corner, but Providence says it's already starting to see an uptick in COVID cases and hospitalizations. It's why doctors recommend everyone get vaccinated for COVID-19, flu, and some for RSV.
We'll see higher rates of transmission of COVID in the winter than we would around the summer.
As it gets colder and we gather for the holidays, it's a lot easier to catch the flu, COVID, and for some age groups, RSV.
A lot of people heard the term triple-demic that was out last winter season. The combination of RSV infection and influenza infection as well as COVID infection.
Experts say our best defense against all of these are vaccines. But with updated vaccines coming out, who should get them and when?
People that have had fairly severe infection in the past really need to consider getting this new vaccine to help keep them as protected as we can. And really, it's a good idea for everybody.
Even if you've never been vaccinated, you're eligible for these new boosters. Dr. Getz says that COVID has mutated so much since 2020 that previous vaccines could be ineffective against this new variant.
Without this booster, could really be looking at a pretty ugly infection again without the protection.
He says to get those COVID shots now and get those other vaccines pretty soon.
So October is probably a good time for influenza vaccine. And then if you're a candidate for the new RSV vaccine, that's probably a decent time to consider that as well. But for the COVID vaccine, now's a great time if you're going to get vaccinated.
If you recently had COVID, Dr. Getz says to wait 90 days to get the updated booster. And if not, he says it's completely safe to get not just your COVID shot, but also your flu shot all in one go. And one more tip, as more people gather for the holidays, immunocompromised people or those with an increased risk of illness might want to keep masks on hand and mask up as necessary. Live in studio, Bronte Sorotsky, 4 News Now.